Thanks very much, John. And thank you, Jim, for that introduction about the change that we're all facing in approaching BIM. I think what I'd like to talk to you about this morning is just some of the issues that we have come across in the way in which we are developing BIM in our office, and the challenges that we have faced, and some of the issues that we would like to focus on in developing BIM further so that it works for us on our projects. We're a practice of about 20 architects focusing mainly on healthcare. Most of the projects that we carry out are quite complex in terms of the coordination aspects of mechanical and electrical elements and of the functional elements associated with the projects. And what I'm going to focus this morning on is particularly on the Children's Hospital of Ireland, which is a large-scale public project that we are working through BIM, and I'm going to use examples of that to explain how we are approaching the various changes we're at. I think it's important to say that we all recognise that we're at an early stage in BIM, and to that extent there is, as Jim has put it very well, there's a certain reluctance, I think, amongst people to embrace that change. I think partly because of fear, partly because of the unknown. And I think it's important at the very outset that we spend some time individually as practitioners to think, what is BIM? And I mean by that, what is BIM for us, and how we can make it work, and how we need to make it work for ourselves. And so I'm going to, there are about 6 or 7 points that I'd like to speak to you about this morning. I don't know if everybody can read that very clearly with the shadows, but there are about 6 or 7 points that I'd like to just dwell on in terms of how we are approaching it. Now, BIM itself, is defined by AutoCAD as this issue of just coordination of internally consistent computable information, effectively the collation of data. But I think it's the first thing that we have to do, and we have done, is really decide what is BIM for us, and what are the things that we feel are important in the way in which it can improve the way in which we work as designers. And the very first thing for us is that it allows us not just to think in 3D, but to work in 3D, and the visualization of everything that we do, down to all of our details in 3D, really, I suppose, is a fantastic tool for us as architects to be able to actually work in a mechanism in which we think, because we generally think in 3 dimensions. I think we're encouraged and we're trained to think in 3 dimensions, and yet the tools that we've been using, whether it's over the last while, have generally been 2D tools. So the availability of 3D tools at all stages of a project has really, I think, has galvanized us to allow us to think a lot more about the way in which we can develop a 3D design approach. And I think this is going to change the way in which we as architects and designers actually design and deliver buildings, and I think that's going to change the way in which buildings are built and they are presented to us in the future. That is really exciting, I think. It is not anything to be afraid of. It's something we've always wanted, and something we've always thought we would like to have. And now that it's here, we shouldn't be afraid of actually embracing it, because it is a fantastic mechanism to have at our disposal. The next issue is one of efficient production of information. I think it's very important they are in that order. Jim has mentioned this earlier in his talk, but the efficiency of production of information is important, but it is something that must actually follow I suppose the design logic of what we do, so that it's not leading the process, but it's something that is part of the overall process. The third issue for us is one of accuracy. Accuracy is exceptionally important, and having a tool that allows us to actually focus right in on making very, very accurate drawings and details that are coordinated with all of the other design team data is something to be embraced. We have always worked when we're working in 2D or working in pencil, it's very easy not to be accurate. But working in 3D in a process where everything is designed in a coordinated basis and to the last detail in 3 dimensions, I suppose allows us to be much more accurate than heretofore. BIM also will allow us to support much more design analysis of what we do. And when in the healthcare area that we work in particular, the outcomes of what we of the design approaches that we have, and by that I mean that the outcomes for our clients and for our patients are very, very important. And it's part of the whole design philosophy that we have, is that we try and design environments that will encourage and help recovery of patients in healthcare buildings, or essentially for the well-being of our clients. And the analysis of how our design supports that is very, very important. It's at a very early stage in all of the I suppose research that has happened over the last number of years, but it is something that is going to be much more prevalent in the future, and I think BIM affords us some support in that analysis. The next thing for us is really the intelligent contract site, if we can call it. There is, I don't think there's any reluctance among contractors necessarily to embrace BIM, but there is an opportunity for us, I suppose, in terms of the design side of the profession that leads and presents documentation to contractors, to actually set up a much more intelligent process by which buildings are built and procured. And finally, the whole FM support area, and the whole way in which buildings are considered after they are built. The data that's available and the data that's inputted through BIM will help support that facilities management and analysis of buildings afterwards. So they are the categories for us that I think are very important. And in this case, in the case of the Children's Hospital, I think that there are a couple of other issues in respect of large-scale complex projects, the whole issue of multidisciplinary teams, and I suppose at the bottom there, the brief requirements of our client. Having our client support the whole input into BIM, and having the BIM model embraced by our client is very supportive to a team that gets involved in it. I think for us there were 3 or 4 things that we had considered at the outset before we decided to work with BIM on the Children's Hospital, and we did look very carefully at some of the other models, some previous models that had been worked on healthcare buildings, on large-scale healthcare buildings, before we decided to embark on it on this project. One, and there are 3 or 4 things that I just wanted to mention to you that I think are very interesting. One is the whole issue of prefabrication can be much more supported through building information modelling. And prefabrication can lend itself very, very well to large-scale healthcare developments, where there is, for instance, a repetition of, in this case, single rooms in new buildings, and the preciseness that's required in terms of the delivery of internal elements and internal partitions that are both coordinated and designed into singular elements and delivered to site in a prefabricated basis. That is very helpful to us as designers. Secondly, the coordination of the structural systems within the building can be much more carefully analysed. This building I'm showing to you now is a building that was carried out by our partners in Mass General Hospital in Boston, in which BIM was used as a model for the project. And also the mechanical and electrical systems, and you can see that this is just an example of the ventilation system and the coordination of the ventilation system, and more importantly the coordination of the 2 elements there between mechanical, electrical and structural systems, which are absolutely key in clinical areas in healthcare buildings, that they are analysed and designed and detailed at the outset of the project rather than being done on site after the event. The analysis of that at the early stages, at the design stages, is extremely important for us. So they were some of the background information that we used to support the decision that we made to run with BIM. They're also, we are working through Revit on this project. It doesn't have to be Revit, but I think that the one important thing we need to do is to decide that if you're working on projects, that there's a single platform on which everybody is working. And in this case, we consulted with the whole team on the project, and we agreed in this case that Revit will work best for us. So we're working on Revit. Initially started in 2010, Revit, and now on 2011. And I think that the way in which we are working through the project is that at very early concept and design stages, we did work very much at a 2D format to begin with. And the reason for that was that, there were 2 reasons for that. One was that we were still evaluating the tool and the models within which we would develop. And secondly, that we felt that the early stages of sketch design were not fully developed enough for us to work through BIM. They weren't fast enough, or they weren't quick enough, and they weren't giving us enough responses. Now, that may have been our fault, it may have been maybe the program's fault, but it just wasn't working for us as well as we would have liked it to work. So we have, after the concept stage was completed, we actually moved into the Revit stage of the project, and so there was a transition from 2D to 3D, and that was led by ourselves, immediately followed by the structural engineers and the mechanical electrical engineers. We've set up a coordination process within our design team so that there is an RDP server, which is a single base server in the architect's office. In this case, because we're working with our team with NBBJ Architects in London and the United States, the RDP server is based actually in London, but it's worked on, it's a live server for the architects on the project, and it's fed into by all of the engineers and updated weekly, although it's live for us. And the very important thing is that it is live, because it is then a live document for everybody to input onto. And the outputs for the quantity surveyors are equally important, and the CAD measure element of BIM, which becomes an output tool for the quantity surveyors, is something that will give a lot more information, a lot more data to enable much more accurate quantifying of the project. These are just examples of some of the drawings that we're currently at in terms of the internal floor plans. You can see that the whole project is now on BIM through 3D. So these are 2D representations of the 3D model, but the output representations and the output renderings and so on are very, very easily produced. So they can be just represented in whatever format you want, in whatever color format you want.